Rock.
Crime, chaos, drugs, and disorder. That's what we have after 9 years of this NDP Liberal government. The extremist policies of this Prime Minister have forced parents in British Columbia to protect their kids from used needles at the playground. Open, in-your-face drug use in Tim Hortons, on the SkyTrain, even in our hospitals. The Prime Minister's negligence is killing our citizens. When will he admit that his radical decriminalization experiment has failed and end it?
The Honourable Minister for Mental Health and Addictions.
Mr. Speaker, too many Canadians are dying every day from an ever-changing illegal toxic drug supply. The opposition leader and members of the Conservative Party are a big talk about investing in treatment, but Conservatives cut 2/3 of the drug treatment fund when they were last in government. Shameful. Let's talk about what saves lives, Mr. Speaker. Safe consumption sites, accessible social and healthcare services, prevention, treatment, and harm reduction. They have no plan, Mr. Speaker. On this side of the House, we continue to work to save lives.
The Honourable Member from South Surrey, White Rock.
Well, let's talk through a clear lens, Mr. Speaker. 40,000. That is the number of Canadians that have died from drug overdoses since 2015. Entirely preventable.
I think that's the amount of people that have taken MAID as well.
Over 2,500. And they want to talk about saving lives and compassion. Premier Eby and this Prime Minister have failed British Columbians, and now he's taking his deadly experiment to Toronto. Until this extremist drug policy is dismantled, people will keep dying. Will he prioritize recovery and stop killing Canadians with his radical ideology?
The Honourable Minister.
Yeah, people are actually dying because of Justin Trudeau.
Mr. Speaker, the opposition don't want to talk about the plans or the tools that are needed to save lives because they don't have a plan. All they offer Canadians are slogans and fear. Slogans are not an evidence-based strategy, Mr. Speaker. They are just words. We have a full suite of measures that address this crisis because it's a public health crisis, Mr. Speaker. It is not a criminal issue. We continue to work with BC on the exemption that they requested with a clear lens of public health and public safety.
Good job. Good job.
These guys caused the problem and offer to sell the solution.
Murray, Cold Lake.
Mr. Speaker, this NDP Liberal Prime Minister is not worth the crime, chaos, drugs, and disorder. After 9 years of the Prime Minister's extremist policies, public drug use has become the norm. The Prime Minister has made it legal in British Columbia to smoke meth on the beach beside a family or smoke crack in a hospital beside healthcare workers. In fact, a nurse in British Columbia stopped breastfeeding her twin girls early at 13 months because being exposed to illicit drugs in the hallway. When will the NDP Liberals realize that time is up and end the decriminalization today?
The Honourable Minister of
It's the only way to save Canada.
Mr. Speaker, every life lost in the illegal toxic drug supply, every overdose, every family that loses a loved one is a tragedy. Mr. Speaker, our focus, working with the BC government on their exemption request, is about saving lives, about providing health care. Harm reduction is health care, Mr. Speaker. Treatment is health care, Mr. Speaker. Prevention is health care, Mr. Speaker. Enforcement is also part of the plan. We continue to work with law enforcement in the provinces. They continue to divide.
I'm going to ask the member from Northern Rockies to please make sure that he only takes a microphone when he is recognized. The honourable member from Fort McMurray, Cold Lake.
I'm sorry, Mr. Speaker. Drug deaths are up 380% in BC since 2015 when they took office. So the NDP Liberal Coalition unleashed a horrific experiment in British Columbia, and now the NDP Premier is pleading with the Prime Minister to fix this disaster. But what we're learning is the Toronto minister has decided they're going to double down and they want to expand this failed project into Toronto. After 9 years, this NDP Liberal government's drug policy is failing Canadians, and the Prime Minister is not worth the cost. Instead of expanding this, will they do the right thing and just end this policy today?
There you go. Drop some W's in the chat for that. That was good.
Minister of Health.
Mr. Speaker, around the world, opioid deaths are taking so many lives. The only way we can rise and meet that moment is with truth and evidence, and not inflaming through spreading false information this situation. I would ask the member opposite, instead of trying to seek opportunity to attack in this House, to work collaboratively on evidence-based solutions that save lives. Like her, like every member of the House, when a life is lost, it rips us all apart. And we have to meet it with truth and honesty and set aside partisanship, Mr. Speaker.
The honourable member from Caribou, Prince George.
Mr. Speaker, overdose is the leading cause of death in my province of British Columbia. This NDP Liberal Prime Minister's extremist drug policies have turned our neighbourhoods into war zones. Hard drugs are being used in playgrounds, coffee shops, and even hospitals. Last week, a drug-addled man lit fires and consumed drugs in front of traumatized kids at the Prince George Aquatic Centre.
Yeah.
They were called numerous times, but their hands are tied because of their insane drug policies. Will the Prime Minister end his deadly drug decriminalization today?
At my local pool, dude, people were doing drugs inside my pool and outside in the bushes, and the cops did
I would ask
nothing.
clearly, what evidence are they basing their decisions on? And the answer to that question...
Yes, sit down, Mark Holland. That whole event that happened at my local pool, man, is insane. That took off in the local news and in BC.
The honourable minister has 25 seconds left on the clock.
Mr. Speaker, replacing science with slogans, replacing research and evidence with talking points will not fix this problem, Mr. Speaker. There is not a person in this House who is not ripped apart when we watch somebody lose a loved one to this crisis. But to meet it with partisanship, to meet it with pretend solutions, to do things that have failed in other jurisdictions is a disgrace to those who have lost family members, Mr. Speaker.
Let's give druggies free drugs, says the cartel.
The honourable member from
the government of Canada.
This NDP Liberal Prime Minister is not worth the crime, chaos, drugs and disorder. After 9 years, this Prime Minister's extremist policy allowing for deadly hard drugs to be used in public spaces such as parks, coffee shops, beaches and hospitals. A leaked memo in BC is now instructing nurses to teach patients how to inject illegal drugs into their intravenous. Jeez. Will the Prime Minister end his deadly drug decriminalization experiment today?
The Honourable Minister of Mental Addictions and Health.
Speaker, on this side of the House, we are committed to saving lives and making sure people who use drugs don't die alone. We moved forward with a decriminalization pilot project at BC's request and have always maintained it would be rigorously monitored and adjusted as needed. We know a full suite of tools, including harm reduction, are needed. Even the MP from Caribou, Prince George, knows it. He said himself, quote, "I asked if safe injection sites were helping. They did say that safe injection sites probably do help." Mr. Speaker, every tool, every resource to save lives is what we are committed to.
After 9 years of this Prime Minister, Canadians are skipping meals and food banks are overwhelmed. 83% of Canadians are paying $80 more a month for food than they were just 6 months ago. According to Second Harvest, more than half of the food banks in the Toronto area can't meet demand, and they're putting families on wait lists. Families can't afford to put food on the table, and the crisis is getting worse when the Liberal NDP government increases the carbon tax 23%. Will the Prime Minister reverse his decision to increase the carbon tax, pass 234 in its original form, so Canadians don't have to dumpster dive for their dinner?
The Honourable Government House Leader.
As the member well knows, Bill C-234 is in the hands of the Conservative House Leader. The member should speak to him.
The Honourable Member for Foothills.
This NDP Liberal government isn't worth the cost of food. While Canadians are skipping meal, the ministers who are in charge of lowering food costs for Canadians is rubbing shoulders with Hollywood celebrities and political elites at the most expensive dinner imaginable. He's dining out at the White House on the taxpayer dime. After 9 years of this Prime Minister, he's out to lunch and the ministers are out of touch. Will the Champagne Coalition and Caviar Caucus lower food costs for Canadians and pass 234 in its original form?
The Honourable Deputy Prime Minister, Minister of Finance.
Good. Mr. Speaker, 2 weeks ago, we presented our budget to deliver fairness for every generation. Because right now, a nurse or a carpenter can pay taxes at a higher marginal rate than a multimillionaire. That's not fair, and we're changing it.
Bro, this doesn't hurt multimillionaires. It hurts the everyday person, man.
Opposed to our budget.
You make profits on a house, and now you're paying 66% tax.
The only thing they know how to do is cut, austerity, and quietly to keep on delivering tax breaks to their rich friends.
It hurts the middle-class people that get to make a buck off a good investment.
Are being pushed to the brink with high demand and donations not keeping pace. Speaker, after 9 years of this NDP Liberal government, that was this morning's headline. Canadian families cannot afford to buy food, and our farmers who grow food face punishment, not progress. No farms means no food. From high cost to empty store shelves, this Prime Minister and his costly carbon tax are not worth the cost. So will the Prime Minister finally axe the carbon tax so our farm families can stay in business and Canadian families aren't forced to use food banks?
Good question.
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, our government believes in fairness for every generation, especially younger Canadians. That's why we are investing in building more homes faster. We're investing in making life more affordable with programs like early learning and childcare and dental care. And we're investing in jobs and growth. And we're paying for it by asking those at the top to contribute a little bit more. But the Conservatives are opposed to our plan. The only thing they believe in is austerity and quietly giving tax breaks to their rich friends.